friends, to TD5 News at 9, and it's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Anwar Zaytoun. Thank you so much for being here. How are you, doctor?
Good morning. Thank you for having me. I'm doing well. About yourself?
I'm doing great. Thank you. Thank you so much. We are talking about today peripheral arterial disease. Doctor, first of all, what is this?
Peripheral arterial disease is a very common problem. However, it's under-recognized. It's basically a progressive problem where the blood flow is affected by blockages, mostly affecting the legs, but it can affect the arms and even the neck vessels, causing different problems. It's commonly seen in patients who have diabetes, high blood pressure, smokers, and eventually they will have fat buildup in the arteries, causing narrowing in the artery itself or in the vessel. And eventually this can cause complete blood flow problem and vessel occlusion.
Okay, so go over a few of the factors that put someone at risk. You said diabetes.
Age is one of the most important factors. Diabetes is a very strong risk factors. Being smoker is also a big risk factor that can cause the disease to progress faster. And having high blood pressure, high cholesterol, also having other blockages elsewhere in the heart, receiving stents in the past can definitely put you at higher risk of having peripheral arterial disease down the road.
Yeah, doctor, what are some of the signs and symptoms that people need to look out for?
That's a very good question. To start with, this disease could cause no symptoms in the beginning, so screening is very important.
Yes.
But the most common symptom and the first symptom that patients complain of is pain in the leg with walking. The pain will be in the leg that has decreased blood flow. It will start with physical activity, and then the pain will go away with resting. Then if the disease is left untreated, this problem could be more progressive. The pain can be even noted at rest, and some patients might have eventually ulcers or wounds that are not healing well, and despite medical therapy.
Yeah, wow. So what are some of those simple changes that people can make to prevent it?
First of all, watching your diet.
Okay.
If you have diabetes, this should be well taken care of. Controlling the high cholesterol, smoking cessation, and the most important of all of them is exercise. Exercise is very important because it improves the blood flow to the legs, and it can allow the patient to detect their symptoms when they start as early as possible. So we have some room to, prevent this disease from getting worse by medications, and also doing procedures to improve the blood flow to the leg when we need to.
I love that. I love you said exercise. That helps us boost our mood as well as physically. So this is great. Yeah. So what resources? I know there are a lot of resources that are available. You say, viewers, don't worry. There's help.
Oh, definitely. First of all, for patients with risk factors, they have to bring this up when they see their family doctor or their heart doctor. Some patients might be eligible for screening for this disease, especially if they have the risk factors. If patients have symptoms, they should bring it up as early as possible for us, because we do have few simple tests that can allow us to diagnose this problem very early, allowing us to intervene with medications and sometimes procedures to improve the blood flow to the leg or the arm, to prevent the symptoms from getting worse and to prevent the worst outcome of PAD, which is amputation.
Oh, good. Yeah, so there's help available, so not to worry about that. So why are you so passionate about awareness for our viewers?
I believe I've seen the whole spectrum of this disease with patients with no symptoms, and I've seen patients who lost their toes, foot, and sometimes, leg because of blockages that can be completely, prevented if it's detected early. So this is where my passion is coming from, and the technology now has advanced significantly to allow us to do procedures in addition to medical therapy to help this disease from getting worse and to halt this process in the very early stage.
Doctor, is there anything else you'd like to tell viewers? I know you said earlier about making sure you get checked. Anything about them? Is there a message that you'd like to give viewers about that?
Definitely, I would like to encourage patients to, again, bring up their symptoms. We have multiple screening events in the community also a few simple tests that can be done. We can simply measure the blood flow to the leg and compare it to the blood flow or pressure in the arm, and that would be a very simple test to do at any doctor's office that can diagnose this problem as early as possible. So I do encourage patients just to make sure they discuss that with their doctors, their caregivers, and make sure this is not missed, especially if they have all these risk factors. So I really urge my patients and our community to look for the symptoms, look for any signs that could indicate that they have blood flow problem.
Look for your symptoms and also help your family members look out for theirs as well. Thank you so much, Doctor, for coming in today and giving us this valuable information. Really appreciate it. Gives us peace of mind, that's for sure. Thank you.
Definitely. Thank you for having me.
Of course, you're so welcome. If you'd like any additional information on today's topic, just head on over to the Hot Links page. That's at WNEM.com.